What have you all heard, where are you in your conversations around whether this program is going to work without Planned Parenthood?
Well, we have been working with HHSC to try to get the information to ensure that the data that we have is accurate, and I know that they're continuing to work on it, but my confidence is not really great at this point in time, in that initially a lot of the data that was on the website indicated duplicate providers who did not actually plan the direct services to women. When my office called, plugging in zip codes from Austin, we would go through numbers of the providers before we would get to anyone that said, yes, we actually take women's health program clients. In addition to that, the recent data that came out to support the list that they had, which I have to say also they've removed that provider list from the website right now while they supposedly clean it up. But the data to support it, that they based the numbers of the capacity of providers on, also has some errors in it. There's my own particular physician whom I contacted had indicated that he could provide half the capacity at most that was reported in the data. There was a clinic in San Antonio that was going to jump from something like 40 clients to 20,000 some odd clients. I mean, huge numbers. How in the world can you say that's going to happen in a clinic that has, whatever it is, 3 to 7 physicians in it at most? They told us that they had been given information by HHSC that indicated it could kind of be ballparked, and then had been given some suggestions by HHSC. I don't know how this is happening, but when I hear those stories, when I call my own physician and find out what's going on, it indicates that the numbers may not be exactly what they seem, and certainly we have been saying we have a shortage of physicians, a shortage of nurses, declining participation in Medicaid by physicians because of reimbursement rates. It makes no logical sense that all of a sudden we would have an overcapacity of providers. I don't get it. It doesn't make sense.
Now, HHSC has said that they performed an internal survey of many providers, particularly in regions where there was formerly a Planned Parenthood clinic that was participating in the program. They came back with results that showed that there were only 2 parts of the state where they thought they might have an issue capacity-wise, but that everywhere else they felt like the program was robust. Have you had any conversations with HHSC? What have you heard as far as that's concerned?
I have had conversations with HHSC, and that's exactly what I've been told. And I choose not to think that there is anything nefarious going on. I believe that they're working as hard as they possibly can to find the providers that are necessary, if they exist, without Planned Parenthood. But I did want to take issue with one of the first things that you said, which was that Texas chose to forego the federal matching dollars with the affiliate ban. But this is a pilot program, and the Obama administration could have still sent the money because it's solely up to the discretion of Sebelius. So the federal government chose not to send the money because of the affiliate ban, but that wasn't necessarily a requirement.
Well, you're an attorney. The federal government, the Obama administration, said that the state's affiliate ban violated the Social Security Act and that they could not comply because it was a violation of federal law. As an attorney, are they making that up?
Well, the affiliate ban was passed not only last session in Senate Bill 7, but the session before. And we still continue to receive the federal matching dollars.
Right, but the state was not enforcing.
Obviously it wasn't being enforced.
The state passed the affiliate ban, and then the state, internal lawyers that looked at it at the state thought that maybe it wasn't constitutional, and so they didn't enforce it until the following year with a different makeup of the legislature that said, really, we want Planned Parenthood out. So I think, in your opinion, I guess legally speaking, is the state on solid ground? Would the state have been on solid ground would the federal government have been on solid ground to say, fine, we're going to keep funding this?
Well, it's up to the courts, and so far the courts have said that in fact Texas can ban providers. And so therefore, because the courts have upheld what the legislature has done with the affiliate ban, I see no reason why Sebelius shouldn't continue to send the matching dollars.